My experience at the practice was a great one. The staff was very, very friendly. Dr. Huettner was very, very friendly and made me feel very confident about the procedure. I went in going with a little trepidation. I was kind of nervous. I wasn't sure what to expect, and Dr. Huettner basically explained the whole procedure to me, made me feel very comfortable, very at ease. I felt very safe in her hands, and I was very happy with how the staff treated me. I felt very like family, basically. The type of procedure I had done was a breast reduction. I was looking to do the breast reduction since I was about 16 years old. I had gone to a doctor, my mother's cousin, and I explained to him I wanted to have the procedure done. And he basically said to me that I needed to wait until after I had children, because if I had the breast reduction done before that, they would eventually grow back again. So he wanted me to make sure that after I had children, also if I wanted to breastfeed, that I would be okay afterwards to have this done, not before. I was doing some research on Real Self, and I was looking up doctors for breast reduction, and I came across Dr. Huettner's site, and I looked into it, and it seems that all of her patients were very happy with the work that she did with them, different types of procedures. And I scheduled a video teleconference, and I was very happy with how Dr. Huettner came across. Very, very polite, very, very friendly. I felt very comfortable and at ease with her, and I decided that she would be the doctor to perform this procedure on me. I think there's, I guess, a lot of stigma when it comes to MS and having surgery, because they feel that maybe they feel that, you know, I have MS, what good is surgery going to do for me? But having MS kind of made me a little nervous about having the surgery, but at the same time, I'm like, you know what, I may not get this opportunity again, I'm gonna try. And again, you have to have doctors that are there for you to answer every single question and go through the pros and cons of having surgery, whether it's surgery that's elective or surgery that's a necessity, any type of surgery. So I would not be afraid to explore any type of surgery if this is something that you really want. I'm ecstatic that I underwent surgery. It was something that I had dreamed about since I was 16 years old, and to actually have it done and the results that I received, I was very ecstatic. I couldn't ask for anything better. I was very happy with the procedure. I had very little pain. Maybe like the first day after that, I had no pain whatsoever. The swelling wasn't as bad. Dr. Huettner told me basically what I needed to do to make sure that everything was okay, and I was fine with it. Relatively no pain, very, very simple. Had no problems with sleeping. I took maybe one Tylenol afterwards for the pain, and after that I had no pain whatsoever. No issues with sensitivity. Sensitivity was perfectly fine, and that's pretty much it. Looking at how I see them every day and then looking them after, I was very pleased with the results. I did not expect them to look like that. I was very, very happy with the results. It was like night and day. I saw how they were prior to the operation, and then I saw them after, and I couldn't ask for anything better. It was perfect. When I first received the call, I spoke with Mirsis, was the person I spoke with, and she basically laid everything out for me, explained every single detail. Very, very friendly, was very concerned for, you know, any concern that I had. She addressed it properly and efficiently, and very, very friendly. And then when after I had the procedure, staff was always very friendly, followed up with to make sure I was okay. Dr. Huettner also followed up to make sure I was fine. And I couldn't ask for a more pleasant experience with both the staff and the doctor. I would definitely recommend this practice to friends and family and coworkers, anyone who asks me. I guess thinking back, how I wanted the procedure would be something that would not cause me a lot of downtime. Also my concern was, being that I have multiple sclerosis, that how this procedure would affect me. Would I be able to tolerate the anesthesia? Would I be, how healing would be? So I did a lot of research into the different types of procedures, the lollipop, the anchor, everything, to see how it would work, and it seemed to go fine. As far as having multiple sclerosis, my first thing would be to speak with your neurologist or whoever your doctor is, and talk to him about the probability of how anesthesia may affect you, to see if first of all, if the procedure is okay to be done. Because if he or she doesn't give the okay, then you really can't have the procedure. But I was lucky, my neurologist spoke with the doctor, and it seemed that everything was perfectly fine. I was well enough to take care of it. And then once it is, just follow up with both the doctor who performing the procedure and the doctor, your neurologist, my assumption would be, see how everything would be. But I would be, if you are seriously thinking about having it done, don't be afraid. I know surgery is kind of high risk. It's risky. It's scary. But if you have a good foundation, both your doctor and also the doctor performing the procedure, you should have relatively no worries. You should have no worries about having this procedure done. I found Dr. Huettner on Real Self, doing search on doctors who performed breast reductions. I definitely needed a doctor who was board certified also, because when you're having surgery, you want to be sure you have the best possible person working with you and making sure that everything goes fine. On the first day, the morning of surgery, I woke up, I was a little nervous. To calm me down, I put some music, I did a little bit of exercise. I just wanted it to go well. And when I got to the place, I was still a little bit nervous, but everyone there made me feel very relaxed. So I said, okay, this is fine, I can go in with no problem. And I was very calm when I went in, and I was actually anxious to do this. That I was anxious to get it over with. I was just very anxious to do it. So I went in calm, and I was fine. After surgery, the doctor called me to see how everything was. I think nurses also called me to find out how I was doing. Asked me if I had any pain, asked me how I was feeling. And very, very well. And even after, maybe about a few days, a week after, I would call again. And I was very happy with the way the staff kept up, checking up on me, making sure that I was okay, addressing any concerns I may have had during that time. My pain level was not what I expected. I expected it to be, have a little pain for a couple of days. When I was done with the surgery, I had like a little bit of discomfort, but I took a Tylenol and it went away okay. And I really had no pain after that. So the pain was a lot less than I thought it would be, which I was very happy for. I feel great. I feel like a big weight has been lifted off my shoulders, both physically and mentally. I feel I could be a little bit more active. When you have MS, you do kind of feel that burden, like you feel very, very heavy at times. Your muscles are not working the way they're supposed to. So having this extra weight lifted actually does help with moving around, and so I'm a little bit more flexible. I'm a little bit more active in what I do. I really did wish that I had it done when I was a lot younger, at least after I had my daughters. I was like 23 or 24 when I had my second daughter. I wouldn't have mind having the surgery when I was in my early 30s, but because I didn't have insurance to cover it, and it was considered not necessary for me, that's why I waited so long to have it. But then once I was okay and they told me I can have the surgery, I was like, I'm gonna go for it. Basically, when you're thinking of having any type of surgery, your first thing would be to speak with the doctor that's taking care of you, whether it's an MS neurologist or your primary, and discuss with them the pros and cons of having surgery, what the possible effects could be, maybe having anesthesia, would it affect you, all different things. Make sure that all bases are covered when it comes to surgery, because surgery is not something you take very lightly. And you want to go in having surgery with a clear mind and a calmness that, okay, I'm putting this in the best possible hands ever, and it's going to have a great outcome, and not to be afraid. Ask 20 million questions, which I did with Dr. Huettner. I asked her 20 million questions all the time. I'm not, she's probably tired of me asking her, but I just wanted to have answers to every single question that you could, and don't be afraid to ask any questions. Every question is a good question. Never think that a question is stupid. No question is stupid. I guess I can start introducing myself. My name is Mary Lou Clemente. I am a 54-year-old mother of 2 adult girls, and I have MS. Doing this patient interview, something I had never done before. I'm a believe it or not, I'm kind of an introvert. I'm a very shy person, but I like to be able to talk to people in regards to MS, discuss anything and everything regarding MS. I've never been shy about that. And having this surgery was, again, one of the best things I had ever done. I never thought I would ever have it done. So I was very grateful when I met with Dr. Huettner, and we discussed everything, and I do mean everything, in regards to surgery. And I'm very happy with the service that she provided for me and the care that she's given me, and I could not ask for a better doctor and a better person to work with me.
Wow. That's amazing.
Thank you.